people to cover their nose and mouth in all public spaces. The rule was further tightened, with those flaunting it facing fines of $387 per day. President Bolsonaro has argued from the start of the pandemic that measures taken to curb the spread of the virus could be more damaging than the pandemic itself. Meanwhile, Brazil has the second highest number of coronavirus cases and COVID-19 related fatalities in the world after the US. And joining me now to view this is a public health physician, Dr. Blossom Maduafokwa. Good to have you join us, Dr. Blossom. Now, when you look at
Thank you so much for having me.
When you look at the fact that we're seeing a retreat in cases in Europe and Asia, can we confidently say that perhaps the worst of this pandemic is over?
Okay, for this pandemic, we all know COVID-19 is caused by what we call a novel virus. That means it's a new virus which we have not encountered before. So it's difficult to predict how it will behave because we haven't sufficiently studied it long enough to be able to say, yes, this is what it's going to do. Going back to the Spanish flu pandemic of 1918, we all know that there was a second wave in October of 1918 that was even much higher than the first wave. So that's what people are looking at when they're saying maybe there's going to be a second wave. But for this virus, it's a new virus, so we haven't studied it long enough to be able to determine how it's going to behave.
Do you also think that perhaps for countries where we're beginning to see some sort of resurgence in cases, that might be the second wave?
Okay, so to understand what a second wave is, you need to understand that for the first wave to have been considered over, you have to have very negligible numbers of people getting sick. So you're going to have like really, really low numbers. So if you look at sort of a graph plotting the number of cases you've had from the beginning of the epidemic to the end of it, you're going to see like a rise and a fall. So if you don't have that fall, you're not going to be able to say that the first wave is over. So a lot of what people are calling the second wave is actually still the first wave that is still ongoing.
So we haven't even seen the worst of the first wave. Now, we know...
Yeah, exactly.
We've seen the impact of this first wave on the health sector, the aviation sector, education, just on almost every sector, and human lives as well.
Absolutely.
So how do we then begin to prepare in a way that will mitigate the impact of the second wave?
Okay, so the second wave, so one thing we have to understand that for any epidemic or any pandemic to progress, there are three things that have to come, there are three factors that we have to consider, what we call an epidemiologic triad. So that will be the host, that will be us humans, the environment we live in, and the agent itself, which will be the virus that causes COVID-19. So the host behavior, which is us. So how do we social distance? That's where it actually comes in. The mandatory wearing of masks, how do we adhere to these protocols? Hand washing, using hand sanitizers. So that is where the host comes in. The environment, like the Spanish flu pandemic of 1918, what actually caused the second wave was the cooler months in October. It was the beginning of winter. But for this, the virus that causes COVID-19, we still haven't determined if the weather, whether it's cool or warmer, whether it has any effect on it. So basically, the most important thing we can do is human behavior. If you don't have to go out, you stay indoors. If you have to go out, always wear a face covering to protect others and to protect yourself. Wash your hands regularly, use hand sanitizer. So these are the protocols that we have to maintain if we're going to be able to prevent a second wave from having an impacting on education, the economy, and all these other sectors that you just spoke about.
So you speak to individual responsibility in terms of staying at home, wearing your face mask, washing your hands. But what about government policies? For example, in Nigeria, we see that government is preparing to reopen the aviation sector. Do you think that
Correct.
maybe that might be too soon in terms of mitigating the impact of this virus?
So it's something that has been argued back and forth. What will be the benefit of opening the aviation sector? Obviously, there will be an economic impact, positive economic impact. But when you weigh that against the health impact, you're going to ask yourself, what will be the benefit at the end of the day if people are even too sick, for example, to fly? So those are the things that we have to weigh and ask ourselves, will it at the end of the day make any sense if we open these sectors too soon? If we look at some of the countries that have opened too soon and seen the drastic rise in cases, is that something the health sector in Nigeria can accommodate? Do we have the capacity to actually handle the spike in the number of cases? So these are the things that we have to consider when we decide to make some of these decisions.
Dr. Blossom, many thanks for sharing your perspective with us.